What your tongue says about your health. Did you know your tongue could be a mirror to your health? That's right, hidden clues about diseases, deficiencies, and your overall well-being could be lying right there in plain sight. If you've never taken a closer look, now might be the time, because what you find could save your life. Hi there, welcome to our channel, so glad to have you guys here. Today, we're diving into the fascinating and sometimes shocking things your tongue can reveal about your health. From strange discolorations to unexpected textures, we're breaking it all down for you. If you're passionate about staying informed and protecting your health, don't forget to hit that like button, subscribe to our channel, and turn on notifications. It helps us create more life-saving content just for you. The tongue is an amazing organ, not just for tasting food but also as a health barometer. In traditional medicine systems like Ayurveda and traditional Chinese medicine, practitioners have long relied on tongue analysis to diagnose health conditions. Why? Because your tongue is connected to various systems in your body: digestive, cardiovascular, immune, and more. Changes in color, texture, or moisture levels can often be the first sign that something's off. Let's explore some of these signs, but first, a quick disclaimer. Before we dive in, it's important to note that while your tongue can provide valuable insights into your health, these observations are not a substitute for professional medical advice, diagnosis, or treatment. Changes in your tongue's appearance may have multiple causes, some of which might be harmless while others could require immediate medical attention. Always consult a qualified healthcare provider if you notice persistent changes in your tongue or other symptoms affecting your health. This video is meant for educational purposes and to encourage awareness. It's not a diagnostic tool. Signs your tongue gives about your health. 1. Bright red tongue. Possible vitamin deficiency. If your tongue is bright red and appears almost strawberry-like in color, it might be a sign that your body is lacking essential nutrients such as vitamin B12 or iron. These nutrients are vital for producing healthy red blood cells and ensuring your energy levels stay balanced. A deficiency in vitamin B12 or iron can lead to symptoms like fatigue, lightheadedness, and even neurological issues in severe cases. A red tongue might also indicate Kawasaki disease in children, though this is rare. To address this, consider increasing your intake of foods rich in these nutrients, like leafy greens, fortified cereals, or lean meats, and consult a healthcare provider to confirm the cause. 2. White coating. Could signal a fungal infection or dehydration. A white coating on your tongue is one of the most common signs that something might be off with your health. This could indicate oral thrush, a fungal infection caused by Candida overgrowth, which is often linked to a weakened immune system, diabetes, or antibiotic use. Alternatively, a white coating could simply be a sign that you're dehydrated and not drinking enough water. Poor oral hygiene might also contribute to this issue. If the white coating doesn't go away after improving your hydration and oral hygiene habits, consult a healthcare provider, as persistent white patches could also be linked to more serious conditions like leukoplakia. 3. Black hairy tongue. Harmless but shocking though alarming in appearance, a black, hairy-looking tongue is usually harmless. This condition occurs when dead skin cells build up on the surface of the tongue, trapping bacteria and giving the tongue a dark, furry look. Smoking, excessive coffee or tea consumption, and poor oral hygiene are common culprits. In some cases, it can also be linked to the use of certain medications like antibiotics or bismuth containing antacids. While it's not dangerous, it's certainly a wake-up call to improve your oral care routine. Regular brushing of the tongue and cutting back on staining agents like tobacco can often reverse the condition quickly. 4. Sore spots or ulcers. Stress or something more serious. Painful sores or ulcers on your tongue might be a sign of canker sores, which are often triggered by stress, acidic foods, or accidental biting. They're typically harmless and resolve on their own within a week or two. However, persistent sores that don't heal could signal a more serious condition like oral cancer or a viral infection such as herpes simplex. Additionally, certain medications or deficiencies in vitamins like B12 and folate can contribute to recurring ulcers. If you notice sores that last longer than 2 weeks or are accompanied by other symptoms like difficulty swallowing, it's crucial to seek medical advice promptly. 5. Geographic tongue. Benign but bizarre geographic tongue is a condition where smooth, irregular patches appear on the tongue, resembling a map. While it's generally harmless and doesn't require treatment, it can sometimes be linked to underlying issues like allergies, stress, or psoriasis. Some people may experience mild discomfort, especially when eating spicy or acidic foods. The exact cause of geographic tongue isn't fully understood, but it's believed to be hereditary in some cases. If you notice this unusual pattern, keep an eye on it and consider consulting a doctor if it's accompanied by other symptoms or significant discomfort. 6. Yellow tongue. Watch your liver. A yellowish tint to your tongue might seem minor, but it can point to underlying issues with your liver or digestive system. This color change is often caused by a buildup of bacteria on the tongue, particularly if oral hygiene isn't up to par. Smoking, dehydration, and dry mouth can exacerbate the condition. In more severe cases, a yellow tongue could be an early warning sign of jaundice, which occurs when there's a buildup of bilirubin in the blood due to liver or gallbladder dysfunction. If the yellow discoloration persists despite proper oral hygiene, consult a healthcare provider to rule out serious conditions. 7. Scalloped or indented edges. Sleep apnea or thyroid problems. If you've noticed wavy or scalloped edges along the sides of your tongue, it might mean your tongue is pressing against your teeth due to swelling or an enlarged size. This condition, often referred to as tongue scalloping, can be linked to sleep apnea, hypothyroidism, or even stress-related clenching and grinding of teeth. In some cases, scalloping could also indicate nutrient deficiencies, such as low magnesium levels. If scalloped edges are accompanied by fatigue, weight changes, or other symptoms, it's worth bringing it up to your doctor for further investigation. 8. Cracks and fissures, normal or nutrient deficiency. Cracks or grooves on the surface of the tongue, also called fissured tongue, are often a normal variation and more common as people age. However, deep fissures might signal a deficiency in biotin, a B vitamin that supports skin, hair, and nail health. While fissures themselves don't usually cause problems, they can trap food and bacteria, leading to bad breath or even infections if not cleaned properly. If cracks appear suddenly or accompanied by pain or discoloration, consult a healthcare provider to determine the underlying cause. 9. Purple or bluish tongue. Circulation issues. A tongue that appears purple or blue might be a sign of poor oxygen circulation in the blood, often linked to cardiovascular or pulmonary conditions. It could also indicate Raynaud's disease or extreme cold exposure affecting blood vessels. If you notice a purplish hue along with other symptoms like shortness of breath, chest pain, or fatigue, seek medical attention immediately, as these could be signs of a more serious condition like a heart or lung disorder. 10. Pale tongue. Anemia or poor nutrition. A pale tongue, almost devoid of its normal pinkish color, might indicate anemia, a condition where your body lacks enough healthy red blood cells. Anemia can stem from deficiencies in iron, vitamin B12, or folic acid, and is often accompanied by other symptoms like fatigue, dizziness, or cold extremities. A pale tongue may also signal poor circulation or malnutrition. Addressing this issue involves eating iron-rich foods like spinach, legumes, or lean meats, and potentially taking supplements under a doctor's supervision. 11. Dry tongue. Dehydration or Sjogren's syndrome. A persistently dry tongue isn't just a sign you need more water. It could indicate an underlying condition like Sjogren's syndrome, an autoimmune disorder that affects the salivary glands. Dryness can also be caused by medications like antihistamines or antidepressants, or as a symptom of diabetes. Chronic dryness can lead to cracked lips, difficulty swallowing, or even increased risk of cavities. Ensure you're drinking enough water, and if the dryness persists, discuss it with your healthcare provider. 12. Spots or red dots. Allergies or viral infections. Bright red spots or dots on your tongue might indicate a mild allergic reaction, often triggered by foods, medications, or even oral care products. They can also appear during viral infections like strep throat or scarlet fever. If these spots are painful or accompanied by a fever or swollen glands, seek medical attention. Persistent red dots could also be linked to vitamin deficiencies or other underlying health issues, so don't overlook them. Your tongue is more than just a tool for tasting, it's a powerful indicator of your health. If you've noticed anything unusual on your tongue, don't panic, but do pay attention. Your body often sends subtle signals before things escalate, and catching them early can make all the difference. We hope you found this video insightful. If you did, please give it a thumbs up, share it with someone who might need to hear this, and subscribe to the channel for more fascinating health insights. Until next time, stay healthy, stay informed, and keep listening to what your body is trying to tell you.